Hi, Virginia Beach EMS. Chief Brazel here. It's been a couple weeks since we chatted. I'd hoped to talk to you about something other than COVID-19, but that is not meant to be. COVID cases continue to rise around this country. The Virginia Health Department is tracking about 4,000 patients in Virginia Beach alone. That represents about 1 out of every 110 people in this community, or almost double the number that I talked about in my last message. We saw more COVID-19 patients on Virginia Beach EMS ambulances in July than we did in the last 4 months combined. It represented 4.3% of our transport volume, or about 1 out of every 20 patients we took to the hospital. To put that in perspective, that's about what we do in terms of seizures and strokes on a monthly basis. And even if you did not transport one of those COVID patients, I can guarantee you were in one of the more than a dozen medical care facilities that have multiple COVID residents. You were certainly passing through hospitals at the same time as COVID-19 patients. So the risk is there. And with the risk comes the need to protect ourselves. Even before the call, we have to protect ourselves from each other, and that means if we can't social distance at the station, we need to wear masks. We certainly need to wear masks when we're riding around in the ambulance together. I know that's unpleasant. I know we don't want to do it, but it is the standard and we must comply. In terms of going to the call, there is no magic assessment tool or screening tool that will positively identify COVID-19 patients before we arrive. In fact, nearly half the patients that we transported in July only reported illness-like symptoms to the 911 call. So with this high level of risk that we're seeing in the community, we are requiring an N95 mask and eye protection on every call. I say that again, N95 and eye protection on every call. We then can move on to gowns and other higher level of PPE when we have higher risk concerns such as droplet generating procedures, patient with breathing difficulty and whatnot. Now our highest standard respiratory protection is the durable half or full piece respirator. If you have not been issued your half face respirator, please contact Division Chief Kevin Lipscomb so we can arrange for you to come in and get fitted. We have some of the people have already gotten them, and we have more coming of actually reusable canisters for these masks, so we can provide, again, gold standard protection over the long term. Now, I've heard what many of you have said about wearing masks, goggles, whatnot. Not everybody on the scene is wearing the same stuff we are. Not everybody's taking the stuff as seriously as we are. Well, when I hear that, the first thing that comes to my mind is a little my mom's voice in the back of my head saying something like, well, if everybody was jumping off a bridge, would you? Well, you get the idea. I'll say this. Of all the other people responding with you, none of them are getting in the back of a little box with those patients. EMS providers spend longer with our patients in an enclosed space with minimal ventilation for a lot longer than any other healthcare provider. You need to protect yourself. So to summarize, wear face coverings and social distance when not on a call. On the call, minimize exposure as much as we can. Put a mask on the patient if they're not already wearing one. Wear an N95 and eye protection. Consider the higher level of PPE beyond that when needed. When you get to the hospital, decon your ambulance, decon yourself. And of course, watch out for each other. I'm sorry that we have to keep going on and on about this, but it is that important. So on a different note though, I'm happy to report we recently received a shipment of medical grade thermometers for our ambulances. Our original plan was to issue these as part of a larger sepsis care initiative. We still plan on doing that in the coming months, but for now, we believe the thermometers can provide you with some extra assessment capability. We don't expect you to use them for every patient, but they're there if you want to confirm a fever on a patient you think is febrile. Remember though, not every patient with COVID-19 has a fever. As I said, these are medical grade thermometers. We don't believe that household thermometers are really the standard we want to provide to our patient. So that's why we went with the higher level of gear. So, I think that's enough for today. Thank you for listening. Thank you for your service on the front lines of the COVID-19 pandemic. I truly appreciate what you're out there doing every day.